All right, welcome back. Very important Bayou time with one of my favorites. She's come on many times, and Dr. Mary Eschete is on. I said, there you see Dr. Mary. She's a graduate from Louisiana State University in Shreveport School of Medicine, and Dr. Eschete works in Houma and 2 other locations and specializes in infectious disease and internal medicine. Dr. Mary, good to see you again. How are you?
I'm fine. Hopefully you're fine too.
We check every week, we make sure, and I guess that's the thing with this coronavirus. I call it the original, and I call it the Delta. And when I was covering news stories, and of course you on many times in the beginning, we all got psyched up. We thought we got past it. All of a sudden, a variant comes across. We all get alarmed again. So it's a roller coaster ride. As a physician, what are you seeing? How do y'all cope with this?
I see a lot of physicians and nurses, respiratory techs, ambulance drivers. They're frustrated and they're tired. They still want to take care of there's people, they're working, but they are definitely more tired than what they were the first time around.
That's like some of the hospital directors told me that nurses and doctors didn't sign up for this. This is something that comes along for everyone. We didn't think we'd be covering a pandemic, but we are, but you have to adjust.
That's exactly right.
Yeah, and it's a little bit crazy. What are you seeing? What's different from the COVID-19 original to the Delta variant?
The younger age group. Initially, we thought, they thought the more vulnerable people were the people that were older with underlying illnesses. Well, we're now seeing a younger age group and more children that are hospitalized. The number of people in the community that are in their 30s and 40s with really no underlying illnesses that are hospitalized is alarming, and we're trying to do something about this, and then convincing people that they need to, if you think you've got it and you're having trouble breathing, please don't stay at home. Come get somewhere where we can maybe do something to save you. We have better treatments available than what we had the first time around, so that although we're having a lot of people with disease, it doesn't look like the number of people that are going to die initially are as many, but because so many more people are infected, we are seeing a lot more deaths.
And that's the thing, because we sit here and we talk to, and I don't mind telling you, you've always shot straight with us through the years. If I talk to 10 different doctors, I'm going to get a little variation in how they treat this, which I guess is not totally different than the way they would treat anything. Doctors are a little different, aren't they?
The answers are changing. The questions have stayed the same, but the answers are changing. What we thought worked initially didn't work. We initially thought we didn't need masks, but we know from doing studies we do need masks. We also know somebody actually did really some great studies. They built a model that blows air out the mouth, and then they put all these different masks on them to see if they would work. And they, much to everyone's shock, they did work. So that's why what we recommended initially has changed down the line. Science is not static. It changes as we find things going on. And that's why some things are we know work, and then we know some things we think might work. It looks like it's good in the test tube, but when we actually try it out in a human being, it doesn't work.
That's a great point, and I've never heard it told to me yet on the desk like that. A lot of people look of how it works in the test tube and they run with it, but you just made a striking point. When you transfer it into humans, it's different, isn't it?
Yes. That's why when drug studies are done, you try, it looks like it'll work, and then they bring all these bring them out on the market. They tried in one person, then they tried in 10, then they tried in a larger group. to see if it works and to see if there's any toxicity. So a lot of drugs make it through that first part, not as many make it to the second part, and very few make it to the third part. That's why it takes a longer time to bring a lot of different drugs to market. It's not like, oh, we got this new drug, it looks like it's gonna work. Let's try it in a human being. It doesn't work like that. You have to try it in a control situation where it's given to sick people, and you give a placebo to sick people. You give the drug and this something inert, and you see if it makes a difference, because you can give something that looks like it works, and it might look like it works, but when you try it against a control group that hasn't gotten anything, there's no difference in the two of them. And that's how you have to do it. Otherwise, a lot of people think that things will work, and when they've actually tried it, they haven't worked.
We've heard it a lot that this variant really has morphed over into the younger generation, and I really want to stress this to the parents watch, because I still hear parents going, my kid's healthy, it's not going to affect them. That may be the case. In 99%, it may be the case. But I would be disingenuous, and I wouldn't be a good person if I didn't warn them on what could happen. What are you seeing that this has done to the younger generation?
The first time around, there weren't that many children who had serious infections. This time around, pediatric ICUs are filling up around the country. We don't keep pediatric patients here in Hummer who require ICU or ventilated care. We normally refer them to referral centers either in Baton Rouge or in New Orleans. Those places are full. Our Children's Hospital has an ICU with 20 children on ventilators. They've kept them, the patients change who are on the ventilators, but they've kept it pretty full, it looks like, from the press since the end of July. And having a child who's struggling to breathe is really scary. And you hope it doesn't happen to your child, but it may happen. Children under age 12 are not eligible for vaccines. Those 12 and over are eligible for either Moderna or Pfizer. I think that this is important because when you send the children to school and they get the virus from another child who's not vaccinated, they will bring it home to who's ever in the house in the home. Yeah. It can be your child, a younger child, an infant. It can also be your parents, your grandparents, someone who's immunosuppressed in the home, who will then have a more profound, serious case and wound up in the hospital. This, you get vaccinated not just for yourself, but for your family and the community. And you don't want to bring this home to your family. You just don't want to bring it home.
And I know you've heard it, because I've heard it. We hear it on national news. People, their big argument is that vaccinated people are spreading as well. So what is the argument with that?
The argument there is that since they're milder symptoms, they'll be out in the community and they'll spread it. And that's why we're recommending masks for everyone. So in case you happen to be one of the people who has an asymptomatic case. But the people who've gotten the vaccine are rarely winding up in the hospitals. When they are winding up in the hospitals, they're not winding up on ventilators, which is in ICUs. You don't want them there. The breakthroughs have mostly been in a immunosuppressed group who are uncontrolled HIV, people who've had organ transplants or are getting chemotherapy. And that's why the FDA approved a third shot in the immunization series for those people. This is not considered a booster shot. Yeah. That would be a shot to boost your immunity. This is a third shot to in the immunization series because it looks like it takes at least 3 shots to get them to levels that other people would get with 2. So that group is limited to if you've had a organ transplant, that's a bone marrow transplant, a kidney transplant, a liver transplant. If you're getting chemotherapy with immunosuppressive agents, if you have uncontrolled HIV. Now, this is not just standard people who are HIV who are doing fine. Mm-hmm. These are people who are still immunosuppressed. It is recommended that those people get a 3rd shot. It is not considered a booster shot. It's the 3rd shot in the immunization series. Now, I need to tell people that if you fall into those categories, you can get your 3rd shot either at your doctor's office. Terrebonne General has a drive-through. Chabert has a setup with their patients. The drugstores can arrange for you to get those shots, but it's not considered a booster shot. It's considered a 3rd shot in the immunizations. So I'm asking those of you who have fallen those categories, call your doctors, arrange for your 3rd shot in the immunization period.
The information I get from you when I compare it with Phyllis and Dr. Ben or the CIS doctors or Dr. Bobby or whatever falls pretty much in line with what I'm hearing as they talk about young patients getting the variant. What's the youngest patient you've seen?
12. In about 2 weeks ago, someone at Chabert a 12-year-old required intubation and then required transfer to a hospital in New Orleans for higher level care. And I'm sure there are others. I just know of that one.
Did you ever think in your medical profession, especially when the original COVID-19 came around, that you'd be intubating a 12-year-old?
No. And I might add that, the same thing that's going on with the resistance about getting vaccinations occurred when polio vaccines first came out. But the same reasons that people eventually got vaccinated back then was because seeing a child put then on an iron lung was a very, very traumatic experience for the parents, and you didn't want that to happen to your child. So I'm hoping that people will heed the call. We can't vaccinate the children, so I'm asking the grown-ups, people who are old enough to get vaccinated, 12, 20, please get vaccinated. Pregnant women, please get vaccinated so that you can give the antibodies to your child who's not eligible to get the vaccine. The vaccine is safe and it can be used in all these different age groups. Please, it's what we can do to protect others. Remember that vaccines are not just given to protect you, they're given to protect the community at large.
Right. And it's one thing because people always asking us, well, y'all need to go on and talk more about the vaccination. People are not going to listen to people that aren't doctors or nurses on the front. But when a Dr. Mary Eschete says it, or a Bobby Hayter, or a Ben Adams, or Phyllis Peoples, we can go down the line. That's people want to hear from their primary care physicians, then the doctors they go to. When y'all say it, it carries a lot of weight because y'all are trained in it.
I have a lot of patients who wait till they come to see me. I want to hear it from your mouth. And I have a lot of patients that are vaccinated because early on I anticipated the need, and I told them, when this vaccine becomes available, you make sure you get it. And a lot of them heard what I said and have gotten their vaccines. But I have some people that it doesn't matter what I have said, they have been against it. And I'm trying to urge people to go to a reliable source. I know people don't trust the government, but trusting what's posted on Facebook and social media can be dangerous because not everything posted there is the truth. So I have referred people to, there's a New England Journal of Medicine article in which addresses most of these concerns. It was written before the Johnson & Johnson vaccine came out, but it's excellent. It addresses all these things about microchips and magnetism and the vaccine coming out before it was completely tested, and its safety in all these different age groups. You go to New England Journal of Medicine, and then you scroll down, all these little titles come up, and you go to COVID, and then you hit COVID, vaccines. The article's by Paul Sachs. It was written in the New England Journal of Medicine, so it's not political. And so please go to this and read before you make decisions about not getting the vaccine.
Let me ask you this with a little time left, and we appreciate you giving us your time. If you had to break it down, what hits me are percentages. When Phyllis or Ben Adams or Bobby talk about percentages, I want to hear from Dr. Mary Eschete. How many of the ones you're seeing intubated or in the ICU are unvaccinated compared to vaccinated?
They're rare.
Yeah.
They're rare. I see patients who've been vaccinated who are occasionally in the hospital, but they have been immunosuppressed. They've had an organ transplant, or they've gotten major chemotherapy. But for the majority of them are unvaccinated. And this is something you can do something about. It's too late once you have the disease to get this. Now, I might add that once you get the disease, there are treatments available. Please go to the hospital to get something. I just heard on the news the member of the school board who died in New Orleans died at home. She was embarrassed that she'd gotten COVID and wouldn't go to the hospital. So she died in essence at home.
Embarrassment and death are two different things. Yeah.
So you got to get diagnosed, and there are some treatments available, but the best treatment is not getting the disease itself. So we're asking everyone who is eligible, please consider getting the vaccine. Please, the side effects if you get the disease are far worse than the sore arm or the fever or the fatigue you may get from the vaccine itself.
All right. Dr. Mary, I so appreciate you coming on, and thank you for your candidness, and thank you for your service, and thank you for being on the front line.
Thank everyone who's gotten vaccinated. Thank you.
All right. There you have it. Dr. Mary Eschete doing a great job, along with all the other physicians and healthcare workers and frontline workers doing a great job for us. We thank you for sure. And once again, thanks to Dr. Eschete for coming in. This has been a very important Bayou time. Share it with your friends.